Many a times we see that medicine alone is not able to cure an illness completely. Spiritually, it is believed that human offers group healing and channeling sessions every night at 10 p.m. for just 22 minutes, which will help you heal and balance your chakras and energize all these 5 bodies to keep you fit and help you realize your true inner potential. The sessions are conducted by none other than the senior most powerful healers of YPV, Grand Mentor ShriNJReddy sir and Senior Mentor ShriMati ma'am. They will help you experience deep inner healing and relaxation every day before sleeping. You can enjoy deep sleep and start your new day with fresh energy and vitality. Register for our monthly, 6-monthly, or annual packages. Visit the YPV website www.yogapranavidya.com or connect with your nearest YPV practitioner now and register for this priceless opportunity to uplift your health and well-being. Atma Namaste. Thank you. Atma Namaste. Many a times we see that medicine alone is not able to cure an illness completely. Spiritually, it is believed that human existence extends beyond the physical body, and we have 5 bodies or koshas that can help us heal the physical body better. YPV offers group healing and channeling sessions every night at 10 p.m. for just 22 minutes, which will help you heal and balance your chakras and energize all these 5 bodies to keep you fit and help you realize your true inner potential. The sessions are conducted by none other than the senior most powerful healers of YPV, Grand Mentor ShriNJReddy sir and Senior Mentor ShriMati ma'am. They will help you experience deep inner healing and relaxation every day before sleeping. You can enjoy deep sleep and start your new day with fresh energy and vitality. Register for our monthly, 6-monthly, or annual packages. Visit the YPV website www.yogapranavidya.com or connect with your nearest YPV practitioner now and register for this priceless opportunity to uplift your health and well-being. Atma Namaste. Thank you. Atma Namaste. Many a times we see that medicine alone is not able to cure your true inner potential. The sessions are conducted by none other than the senior most powerful healers of YPV, Grand Mentor ShriNJReddy sir and Senior Mentor ShriMati ma'am. They will help you experience deep inner healing and relaxation every day before sleeping. You can enjoy deep sleep and start your new day with fresh energy and vitality. Register for our monthly, 6-monthly, or annual packages. Visit the YPV website www.yogapranavidya.com or connect with your nearest YPV practitioner now and register for this priceless opportunity to uplift your health and well-being. Atma Namaste. Thank you. Atma Namaste. Many a times we see that medicine alone is not able to cure an illness completely. Spiritually, it is believed that human existence extends beyond the physical body, and we have 5 bodies or koshas that can help us heal the physical body better. YPV offers group healing and channeling sessions every night at 10 p.m. for just 22 minutes, which will help you heal and balance your chakras and energize all these 5 bodies to keep you fit and help you realize your true inner potential. The sessions are conducted by none other than the senior most powerful healers of YPV, Grand Mentor ShriNJReddy sir and Senior Mentor ShriMati ma'am. They will help you experience deep inner healing and relaxation every day before sleeping. You can enjoy deep sleep and start your new day with fresh energy and vitality. Register for our monthly, 6 monthly, or annual packages. Visit the YPV website www.yogapranavidya.com or connect with your nearest YPV practitioner now and register for this priceless opportunity to uplift your health and well-being. Atma Namaste. Thank you. Atma Namaste. Many a times we see that medicine alone is not able to cure an illness completely. Spiritually, it is believed that human existence extends beyond the physical body, and we have 5 bodies or koshas that can help us heal the physical body better. YPV offers group healing and channeling sessions every night at 10 p.m. for just 22 minutes, which will help you heal and balance your chakras and energize all these 5 bodies to keep you fit and help you realize your true inner potential. The sessions are conducted by none other than the senior most powerful healers of YPV, Grand Mentor ShriNJReddy sir and Senior Mentor ShriMTI ma'am. They will help you experience deep inner healing and relaxation every day before sleeping. You can enjoy deep sleep and start your new day with fresh energy and vitality. Register for our monthly, 6 monthly, or annual packages. Visit the YPV website www.yogapranavidya.com or connect with your nearest YPV practitioner now and register for this priceless opportunity to uplift your health and well-being. Atma Namaste. Thank you. Atma Namaste. Many a times we see that medicine alone is not able to cure an illness completely. Spiritually, it is believed that human existence extends beyond the physical body, and we have 5 bodies or koshas that can help us heal the physical body better. YPV offers group healing and channeling sessions every night at 10 p.m. for just 22 minutes, which will help you heal and balance your chakras and energize all these 5 bodies to keep you fit and help you realize your true inner potential. The sessions are conducted by none other than the senior most powerful healers of YPV, Grand Mentor ShriNJReddy sir and Senior Mentor ShriMTI ma'am. They will help you experience deep inner healing and relaxation every day before sleeping. You can enjoy deep sleep and start your new day with fresh energy and vitality. Register for our monthly, 6 monthly, or annual packages. Visit the YPV website www.yogapranavidya.com or connect with your nearest YPV practitioner now and register for this priceless opportunity to uplift your health and well-being. Atma Namaste. Thank you.
Hello everyone, Atma Namaste to all. Welcome to another session of transforming lives through YPV healings. Today I'm going to present a case of metastatic breast cancer treated successfully by using Yoga Pranavidya healing methods. My name is Dr. Madhavi Sunkari. I'm a dentist and also a Yoga Pranavidya YPV certified healer and trainer. So let's start our session. Let's understand about the ailment. Breast cancer is a diseased condition where normal breast cells mutate, divide rapidly and uncontrollably, thereby creating a mass of tissue called tumor. So as you could see in this diagram, there are 5 stages of breast cancer, and in the diagram you could see there is a mass of tumor which is represented as red color growth. So breast cancer originates either in the cells of the milk ducts or glandular tissue called lobules, or in other cells, tissues within the breast. This breast cancer has basically 4 stages. Stage 0 is a non-invasive tumor wherein the size is just smaller than 2 centimeters. Stage 1, invasive tumor more than 2 centimeters. Stage 2 is between 2 to 5 centimeters. Stage 3 is bigger than 5 centimeters. But when it comes to stage 4, the tumor has spread to other organs like lymph nodes and other body parts like bones. So this is the metastatic breast cancer. Stage 4 is a stage of metastasis. Early diagnosis gives a better chance of successful treatment of all these stages. Basically, the screening for the breast cancer is done by mammography. So the earlier it is detected, before any symptoms appear much, it's more easier and more successfully this condition, this ailment can be treated. What are the common symptoms of breast cancer? Some of the common symptoms are breast having lumps or hard masses with irregular edges, swelling of all parts or some parts of the breast. There may be a pain in the breast or the nipple area. The nipples are seen retraction, that is turning inwards, and there may be a discharge, red flaky or thickened breast skin or nipple, swollen lymph nodes under the arms or near the collarbone. And if the cancer had metastasized to the other body parts, so there may be some secondary symptoms associated with those parts like pain in spine, lower back, and legs. What are the causes of breast cancer? Getting older, that is, women aged 55 years or more are more prone for breast cancer. Genetic mutations in the genes. Reproduction history, wherein if the menstrual cycle, that is the menstruation of the person, starts before the age of 12 and the menopause after post 55 years, the woman is subjected to exposure of hormones for a very longer period. So that also increases the risk of breast cancer. Having dense breast. So in these kind of cases where there is more of fatty tissue is less and thick, dense connective tissue is more. So in such cases, what happens, it is very difficult to diagnose. And even with mammogram, it is difficult to get a diagnosis. In such cases, the person is more prone. A family history of breast or ovarian cancer, previous treatments using radiation therapy. Here the radiation may be for some other cancer treatments or for some other therapy. Once they are exposed to these kind of therapies, there may be a chance of breast cancer. Physical inactivity, overweight, obesity, especially after menopause, smoking, drinking alcohol. So these are mainly connected with lifestyle. So random lifestyle, non-healthy lifestyle also makes a woman prone to breast cancer. Taking hormones. If a person takes hormones for a very long period, especially the female hormones, the body is subjected to such kind of exposure, especially when they are taking birth control pills, contraceptive pills, and certain hormonal therapies, they are more prone. Exposure to carcinogenic chemicals. Women who have had breast cancer are more likely to get it the second time. So here they are talking about the recurrence. So you may be amazed to listen this, that breast cancer is one of the most common disease after skin cancer diagnosed in the woman. Okay, so what is the prevention? Very simple. Keep weight in check, be physically active, avoid alcohol, and eat healthy. Breastfeeding is suggested if the woman has given birth. It is suggested to do the breastfeeding. Avoid smoking, birth control pills, hormonal therapy. So these are some preventive methods. So what are the treatment? So a very good treatment is available, medical treatment now, because of more advance in the field of surgery and medicine. So how can we treat? Medically is surgery, chemotherapy, hormonal therapy, biological therapy, radiation therapy. These are some of the common therapies are given in breast cancer case. So patient history. So patient history is the patient is 49-year-old female, and she had a very active and very dynamic lifestyle and no major health concerns over there. So how it started is like this, the first symptom she had was pain in her right leg. However, the pain subsided after some warm-ups and running exercises. And so whenever it has happened, she used to do this, and so therefore ignored this problem for a while. And moving to the COVID situation in 2020, the going to the hospital got much delayed in spite of she having some constant regular problem, which she was managing with some painkillers and some applying some ointments and pain management. Inevitably, one day she had to travel a long distance by road, and that is when the pain aggravated and it became very severe. She had expanding pain from the right hip bone down to her right leg, and she stopped doing any activities like walking, running, etc. And she was not even able to stand, sit, and get her from the bed of her own, and she needed family help. And that is when it was an alarming time has come. And they went to see an orthopedician. The orthopedician has suggested an MRI scan, and the scan report read that there was multiple lesions, perforations in the spine. So it was a very clear-cut diagnosis that this was a secondary. There may be a chance of cancer in some part of the bone. And immediately the orthopedician has suggested her to see an oncologist. And she went and got PET scan done. On July 30th, 2020, she was diagnosed with left breast cancer that got metastasized to bones and infected the spine. So this was a very sudden shock to the patient because she lived very healthy lifestyle and she never had any such kind of problems, and she didn't expect. So mentally and emotionally it was very shocking for her, and the doctor has suggested her to take painkillers, monthly medication for bone growth stabilization, and they started radiation therapy and targeted hormonal therapy with regular PET scans suggested. So this is the history of the patient, how it got diagnosed and how the treatment was suggested. Treatment plan was given to her. This patient, she has learned actually YPV level 1 course in 2016. Though she was not a very regular practitioner of YPV, but she knew about YPV, how it works and how it helps. And once in a while, whenever she had a problem, she used to take healing, herself healing, and she used to get better. So that is the time when she approached me and she asked for the healings. So we started Yoga Prana Vidya energy healings in a very vigorous way to address her condition. So what is this Yoga Prana Vidya energy healing? It's a no touch, no medicine, complementary, holistic, integrated healing system. So we complement this with any other therapy a patient is taking. And the idea behind this, our Yoga Prana Vidya healing, is increasing the vitality of the body, thereby helping the body to recover fast. So YPV energy healing is a process of cleaning the energy body of the patient. Our physical body is a direct manifestation of what is there in the energy body. So applying cleansing and energizing techniques to the affected parts and chakras help to balance the energy body and chakras. So this results in faster recovery of the patient, and that's how the YPV healings help. So YPV intervention, what we have done is, as I said, it got diagnosed in the July 2020. So in August, the patient started taking the YPV healings from me, and we did a very vigorous healings for 3 months. In the first month, the duration of the healing was long, and the number of healings per day was also more. So around 4 to 5 times we used to heal, because as the patient was put on targeted hormonal therapy, she was having a lot of side effects of that hormonal withdrawal therapy that they were doing. So to relieve the patient from the pain, from the side effects, and also to stabilize the person for more better mental and emotional health. So the number of healings per day were more. So as the time has passed, after first month got over, she was better in a more accepting way. Her body was responding to the targeted hormonal therapy better. She was feeling better. Her side effects she was able to manage. So then we have reduced the number of healings in a day to twice. And slowly in the third month, it went daily once. Patient was very receptive to the healing energies. And the side effects that she was having was low WBC count, body itching because there was dryness of the skin as hormonal withdrawal therapy has started, severe backache anyway, which she was having, as there was spine and lower back got affected and it got metastasized. And then apart from that, gastric issues, sometimes constipation, sometimes diarrhea because of the therapy, severe gas formation in the stomach, bloating used to be there, and pain in the rib cage. And overall, the movement was very much restricted. The energy was very low. Psychologically, also, she was feeling little low. So all this was addressed with the YPV healings, apart from healing the affected part, which was the left breast area where the cancer cells was growing. So during this entire process, because the healing for this cancer is not 1 day or 2 days or just few months, it's going to be for a longer duration, for a more number of years, as we suggest this. We have asked the patient to learn further, and in the process, we have also suggested patient's family member to learn YPV and start healing her. Patient's husband learned the YPV healings and upgraded to higher levels of YPV, which is Arat Yoga. And patient also further learned few next level of courses, so that both of them started healing and along with me, we were doing healing to her for 3 months. The healing protocol was more involved with entire musculoskeletal system, spine, especially the spine and musculoskeletal system healing was done. The targeted area of breast cancer was addressed. So in June 2021, PET scan was done again, and it showed no active cancer cells. That is exactly 1 year later. So the healing frequency was reduced, and they started healing themselves on the regular basis. The disease, however, progressed again in January 2022. And again, we have resumed the vigorous healing, and I started healing along with them. The patient got significant relief after 2 years of sustained YPV practices. The healing was going on. Patient on a very religious way, she was doing rhythmic yogic breathing in a day 4 to 5 times, forgiveness sadhana, planetary peace meditation. She was attending daily divine healing, which is aired by our organization, Yoga Prana Vidya, at 10 a.m. So without fail, she attends this, and live healing sessions regularly that is done by Yoga Prana Vidya. So on the regular basis, she is to attend all the sessions. Apart from that, regarding the food, we have suggested her to stop the salt and sugar completely, which she religiously did. Very dietary restrictions and taking healthy food she started, as suggested in our therapy of Yoga Prana Vidya. We also talk about the food aspect to support the body. She followed it, and as a result, what has happened, the active cancer cells in her lung reduced again in the May 2022, exactly after 5 to 6 months. Again, when she went for the PET scan, again it got reduced. So these are the reports where in January 2022, the second time when the disease has shown the progression, and again in May 2022, the report read that there is no significant interval change noted in bilateral breast lesions. There is a decrease in FDG uptake of most of the skeletal lesions. So the cancer cells have reduced, and again they have become inactive. So this is how the progress has happened. The patient's feedback, she gave a feedback that I am a 49-year-old ex-army officer diagnosed with breast cancer. I started taking YPV healings and later continued to heal myself. My husband also became a healer and has been healing me since 2 years. Slowly, I started to recover. The quantum of pain in my bones have gone down, and I am able to reduce dependency on painkiller medicines. Overall, there is a significant pain reduction, greater mobility as compared to my initial health condition at the time of detection and diagnosis. By learning YPV courses, we have got a holistic understanding of life and mental health to accept and understand physical conditions. Psychologically, YPV has helped me to grow stronger, positive, and calmer. We can now feel more connected with the soul. We thank our trainers and group for all the love and support. So this was the feedback given. So even now, whenever I interact with her, I have seen immense gratitude for YPV in her, because it has transformed her life and it has addressed her condition. So this was a case of metastatic breast cancer where we successfully healed breast cancer, and we gave YPV as a complementary healing to her. So to know more about this research paper, you can log in our website, yogapranvidya.com. You can also contact us on the following numbers mentioned here, and you can message us to know more about it. So with this, we come to an end. You have any questions, any doubts, any queries, you can type and send me. So let's see if there is any question. Yeah, there is a question which is asking, do YPV healing techniques help not only in medical treatment, but also in the other aspects of our day-to-day life? Yes, they do help. It's a common platform to address everything and anything through energy understanding. So we have a lot of research and literature on this. More than 90 plus research papers have been published in different medical treatment management and also the social, mental, and emotional health conditions. You can, we have addressed diabetes, okay, removing arterial blocks in heart without surgeries. Also, role of Yoga Prana Vidya in treatment of hypothyroidism, lowering academic anxiety and enhancing academic performance of high school children. There is a paper been published. This is all what I'm talking about is where scientifically it has been researched and it has been published. Apart from that, we have a lot of done, our organization has done a lot of groundwork. And we also, you can go through our research paper where the experimental studies have been conducted with successful outcomes such as improvements in well-being of prisoners. Also, a paper has been published in reduction in anxiety and depression in corporate employees. So a lot more is there. So for that, please do log in our website and go through it. So Atma Namaste. Thank you.